Today is July 31st. It's been 6 weeks and a couple days after. I'm doing very, very good since having the permanent spinal cord stimulator implanted. I'm still a little bit frustrated on what I can and cannot do, so I've taken it into my own hands and I've been doing exercising. I've been doing the EFX cardio machine, which is kind of like a stair stepper and a Nordic track ski system. I did that. Well, I've been doing that every other day for the past 2 weeks. However, I've only been doing it for 15 minutes, kind of with a no incline and not really any tension. So today I decided that I'm going to bump it up for 20 minutes. And instead of hanging on to the machine, I got 2 pound weights and I used my arms so I could kind of be building up a little bit of arm strength and back strength. I know it's so important at this point to make sure those leads do not move. So I was trying to be extremely careful. Um, I've been using the 2 pound, 3 pound weights to do kind of arm curls, but making sure there's no pulling in my back per se. So that's why I'm doing very minimal weight, just kind of to get my body awake and my muscles kind of utilized instead of just sitting there doing nothing. A couple days ago, I floated the river um, because there are a few places that require quite a bit of rowing. I was attached to another boat. I'm not using my kayak yet. It was just a raft. And I did some paddling, not too much. Again, I don't want to put those leads, like compromise them, because I know the first 6 months is very crucial. I have since decided that I will carefully wash my rig, and I did that because after 7 weeks of not being washed, it was kind of getting to me. So I am doing a few things. I'm trying not to overdo it. Being that I am a very active person, it's just been really hard for me to sit still. So again, I don't want anybody at the 6 week mark to see this and think that they can accomplish what I'm doing. Not saying that I'm, the super person and I'm doing all these amazing things. I think it just depends on each person, their age, their health. I think a lot of it is because I've always been very active and I've always done cardio and weights. And so my body's pretty used to it. The past 3 years, however, I wasn't able to do much of anything. So I've lost everything that I really worked hard for. I do know that there's, such a thing as muscle memory. So hopefully my muscles remember from the past 3 years ago and will help me get back into the shape that I need to kind of give me the energy that I have been so lacking and so wanting for the past 3 years. So on Friday or Thursday, no, Thursday, about 3 days ago, I went in and saw my programmer from Boston Scientific. And again, I can't say enough about the company. They've been fantastic. He needed to do some fine tuning on my request. I felt like if I was having some additional leg pain that wasn't being covered, because it seems like things will be great and then I'll start having a little bit of leg pain. So I, turn up the remote, but then it's going into my waist and I feel like I'm going to have like a muscle spasm attack. So because my primary reason for getting the spinal cord stimulator was because of my lower leg injury and the nerve damage. I did have some, since getting hurt, I have had some sciatic issues, of course, on the right side. So that kind of helps the coverage, but I really wanted something that was for my back and my lower right leg, but one that also was specifically just for my leg because sometimes I need to have more of that electrical impulse stimulation from my knee down. My broken leg was in the distal third, so just up above the ankle. However, they had to, because of the such bad damage of the leg, there was three really bad breaks. They had to, in the tibia, they had to place an intramedullary nail, which basically they go through your kneecap, and they just pound that nail all the way through. And that's your, it's kind of like an internal casting. So generally, people that have had the IM nail will, or do have a lot of problems with knee pain. So because I've had my knee cut open twice for the nail, it's been pretty sensitive. So I do have a lot of pain in that kneecap. So basically, anywhere from the kneecap down to the middle of my foot is what I generally have issues with pain wise. And of course, it can be kind of in my Achilles area, it can be in my calf area, it can be on my knee. It's, as you know, nerve pain doesn't really have an agenda, it's just whatever. So that's about it for the 6 months. If anything changes drastically, I will definitely keep things posted. But I guess from this point for a while, there's not really much that's going to change. So I'm hoping that these video blogs help somebody, because I know for me, I definitely want to educate myself and know as much as possible before I take on these big challenges. And it just seems like there's such limited information from other people's perspectives, and just how it affects people and what you can and cannot do. So anyway, 6 weeks, July 31st, 2016. Thanks.